If your knee arthritis treatment didn't give you the results you expected, here's what may have been missed. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in rheumatology and regenerative medicine. Let's talk about a patient I saw recently with knee osteoarthritis who had already received bone marrow aspirate concentrate stem cell treatment by another physician. In general, this is a treatment that I would expect to give around 65% pain improvement for the next few years if it is done appropriately. But in her case, she did not have the expected level of improvement. So what happened? In this person's case, the first issue is that her treatment only involved draining the knee and injecting cells into the general joint. And that's a miss. Knee osteoarthritis is not just a cartilage problem. It is largely a problem of instability. That means the ligaments and tendons around the knee are often weak, strained, or not doing their job well enough. If you do not treat those soft tissue structures, then you are not treating a key driver of why the arthritis is progressing in the first place. And this is where prolotherapy concepts really matter. A true regenerative medicine approach should not just focus on pain relief, it should focus on disease modification. In other words, how do we actually change what is driving the condition? If you are not treating the ligaments and tendons and not thinking in terms of prolotherapy and stability, then you are leaving out a very important part of the treatment plan. What we have progressively come to realize is that if you only treat the joint, you may still get some pain relief, but if you do not treat the chronically stressed and degenerating bone, then you're not fully addressing what is driving the osteoarthritis process. And that matters a lot. Because if your real goal is to slow down progression of disease, improve function, and help someone avoid knee replacement surgery, then you have to think beyond the joint space. You have to think about the bone itself, and intraosseous treatments can be a very important part of a more complete regenerative medicine treatment strategy. And then the third issue is that they did not use image guidance during treatment. And this is critical. If you want to properly and appropriately treat ligaments, tendons, and bone, you need precision. Without image guidance, and that means ultrasound or X-ray guidance, you are not able to accurately target those structures that need to be treated. And if you cannot precisely treat the problem areas, then you are not giving the patient the best chance for a good result. So the takeaway here is simple. If your knee arthritis treatment did not work, it does not necessarily mean that your regenerative medicine treatment failed. It may mean that the treatment was incomplete. If you only inject the joint and do not address instability, do not apply prolotherapy principles, do not treat the bone, and do not use image guidance appropriately, then you may miss the real drivers of why that knee continues to hurt and degenerate. That is why the name of the game is not just temporary pain relief. The goal should be disease modification. The goal should be treating the root problem as completely and precisely as possible. If you found this helpful, please make sure to like and subscribe, and check us out at Chicago Arthritis and Regenerative Medicine.